Hi, everyone. This week we are taking a look at a branch of science called system science, which also includes the subtopic of complexity science. We are introducing this to you for two reasons. First, you've been involved in your clinical learning experiences for many weeks now, seeing both the amazing capability and surprising deficiencies in the healthcare system. We can all agree that each of the clinical providers, support staff, and administrators all have the patient's best interest in mind. And yet gaps in care, lapses in judgment, and a lack of continuity are problems that are common in our system. How can we understand how a system that is so well funded and supported by cutting edge science and evidence continues to have these types of common problems? Enter this week's module. Now, secondly, many of you have commented on ways in which you believe that this system could be improved based on your experience in your care setting. This is important and encouraged that you begin to ask questions of why are we doing things this way? And how could we make an improvement? Some of this week's videos will introduce basics of health system science, including a high-level introduction to methods of healthcare improvement. This is a very large and diverse topic that we are only going to scratch the surface of, but we are eager to give each of you greater awareness of the presence of this field of science. Now, take special note of your assignment for this week, which will still be a reflection, specifically reflection number 15. But instead of your typical double entry journal, you will be asked to do one of the following: to develop a basic process map of one aspect of your clinical learning experience. So this is likely a task that you have been routinely involved in your clinical setting. Consider who else is involved in the task, the order of the task, and where your decision points are to proceed or change course. The videos provide examples and more explanation. Another option, instead of a process map, is to develop a human factors intervention matrix for a particular problem you have noticed during your clinical learning experience. This problem is likely something that you've seen many times in your clinical experience, and this tool offers you the ability to strategize ways in which this problem could potentially be solved. Be sure to consider who is impacted by this problem, as well as their perspectives when suggesting potential solutions. So it is not expected that this is a perfect process map or human factors intervention matrix. Give it your best shot. This is a great opportunity to practice these important tools that can be critical in certain healthcare improvement projects. We look forward to hearing your feedback and seeing how you can map processes and suggest potential solutions.